السلام عليكم.
عليكم السلام ورحمة الله.
Good afternoon. Hoping you are in the best of health and iman. Can you hear me or not?
Yes.
Yes, doctor, we can.
Okay. So let us recite al-Kitab and then start inshallah by the first case. Try to have someone who can adjust the timing. Okay. بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم. Who is the doctor? Is it Fatin or Noor or who?
It's me, Dr. Fatin Najiha.
Fatin and Amina is a role player. Okay,
Yes,
you can.
Fatin and Amani, doctor.
Okay, you can start. Fatin, I'm going to examine you after you finish, not at the end. So be alert. Okay. 15 minutes, please.
Okay. So good afternoon, Mrs. Amani, isn't it?
Yes, good afternoon. By the way, I'm sorry I cannot start my video.
Okay, I am Fatin Najiha, third year medical student of IIUM. So can I ask you a few questions regarding your child?
Sure, no problem.
Okay, thank you. So firstly, may I know the reason for you coming to the hospital?
Firstly, I was referred here to the emergency department because my son, Nubina, had unresolved fever for 5 days already.
Oh, 5 days. That's quite long. So can you elaborate more regarding the fever?
If I was not mistaken, before this he was just well and playful, but suddenly, 5 days ago, he started to become less active and he started to develop fever.
Okay, is the fever constant or it is on and off?
Based on what I observed, it is constant.
Okay. So during the fever, what are the average readings?
At home, when I measured his temperature, it was around 39 degrees Celsius every single time.
It's quite high. Prior to the onset of the fever, did your son has any genital urinary procedure or any tooth extracted? Any procedure? Is it?
No, my son didn't have any of this.
No. Okay, during the fever period, you can tolerate his fever well.
I think the fever impacted him quite badly because he cannot do anything. He just lay on his bed and sleep almost all the time.
Okay. Beside of the fever, did he have any other symptoms such as chills?
Yeah, I also noticed he had chills and rigors together with his fever. And there is also this one time he vomited in his room on the first day of the fever. And then the second day he also vomited.
Oh, he vomited. Okay.
Can you
What do you think?
increase the volume, please?
Uh,
Can you increase the volume? The voice is not so clear.
Oh, volume voice. Okay. Can you hear me?
Some more.
Okay. Okay.
Don't worry, the
Regarding
maximum is
the
not much.
vomiters, what is Hmm, wait a minute doktor.
Okay, continue.
Okay. Is it okay now? Oh, video. Okay, okay. Doctor, actually, my internet connection is not really stable, so I'm afraid I have to off the video.
I can hear you.
I'm sorry.
Okay, you can.
Mm,
No issue. Okay.
Okay. Okay. Okay, I will continue. So, regarding the vomiting, what is the amount of the vomiters, and also what is its content?
If I was not mistaken, the amount was just about half a cup, and the content is just like food that he ate before that, food particles.
Or only food, and there's no blood or any bilious content.
Oh yeah, there's no such thing.
Okay. Okay. Is there any pain at the joint or muscles?
My son also complained about joint pain, especially on his knee, both his right and left knee, and he sometimes also complained about pain at his calf, and sometimes he also cry when there is abdominal pain. Abdominal pain, especially at the upper part of his abdomen.
Okay. So besides that, is there any skin rashes?
As far as I observed, there is no rashes at all.
Okay. Any bleeding?
Bleeding also no.
Okay. Okay. And then did you do anything to alleviate all the symptoms?
On the first day of his fever, I actually brought him to GP clinic, and there the doctor give some medication. If I remember, it was paracetamol and antibiotic. And then when I gave him that medication, it doesn't really help because after 2 to 3 hours, the fever will appear again.
Oh, okay. So initially you brought him to clinic. But then after 5 days, did you go to the clinic again?
Oh no, it was just today that this morning I go to GP clinic again, and then this morning when the doctor did some blood test, doctor said that it was abnormal. Therefore, doctor referred my son to this hospital.
Oh, did you know what is the abnormalities of the blood test?
So I don't know. Yeah, I don't know.
Okay, it's okay. Regarding your child, has he been diagnosed with any Amani?
Oh yeah. No, my son is healthy before this. He has no any medical illness.
Okay. So then is this his first hospitalization?
If I remember correctly, this is his second one. He was admitted to hospital last year because of constipation. So this is already his second admission.
Oh, okay. So regarding mm, Mrs.
Sorry?
Has he undergone any surgical procedure back then?
No, he never had any surgery before.
Okay. So if I may ask, how was your pregnancy with him and how was his birth?
I think while being pregnant to him, I had gestational diabetes mellitus. And then at that time, I just controlled my diet. And then when I gave birth to him, he was born full term at 39 weeks. Um, he he was he weighed just 2.2 kilograms. And then, however, after birth, there is nothing significant. He was just healthy after birth.
Okay. How about his feeding during infancy and also currently?
During infancy, I just breastfed him up until 10 months. And then after 10 months, we start giving him formula milk. And so currently he ate just well. He ate just like an adult. He is not a picky eater. Usually he will eat like fried rice, one plate of fried rice. But since he started to develop fever, he he began to eat less. He only took like 4 to 5 tablespoons of rice and then he stopped.
Okay. So is he in school?
Yes, he is in school.
And then, can you share with me about his activities and achievement at school?
His teacher always told me that he is a very playful kid at school. His achievements are well. He usually um, good at academic, and yeah, that's how it works.
Okay. Up now, has he been vaccinated completely?
Yes, I think I never miss any vaccination schedule for him. I always follow the schedule.
Okay, alright. Does he have any food allergy?
As far as I know, no, he is not allergic to anything.
Okay. So Mrs., can you tell me more about your family, about your age and your husband age and your occupation?
Me myself, I am 25 years old. I didn't work. I am just a housewife. And about my husband, he is 28 years old. He worked as a lorry driver. And then we have 3 child. So this child is the first child out of 3. And yeah, that's about my family.
Okay. Um, are there any of your family members who experience the same symptoms as him?
Currently, everyone are all healthy. None of us experience anything similar to Novena.
Okay. So other than that, do you or any of your family members experience any medical illness?
Um, my husband has no illness, but me myself, I once diagnosed with gastritis and migraine. And then other than me, everyone else in the family is healthy.
Okay. And also, if I may ask, do you or your husband smoke?
Sorry, what is the question? Sorry, Nadia. Okay, what is your question again?
Can you
Oh, actually, my husband did smoke. He is a smoker, but usually he only smoke outside the house. He never smoke inside the house. And then apart from him, yeah, nobody else in the family smoke.
Okay. So, may I know where do you live?
We live in Bukit Setongkol, Kuantan.
Okay. Is the surrounding environment of your house clean?
I think my house is clean inside the house, but outside the house, at the house compound, I wasn't really sure if there is any clogged drains or any stagnant water. That I am not sure.
Okay. So inside your house there are no like rats, any rodents infestation?
No, there is no such thing.
Okay. Recently have your family traveled or stayed elsewhere beside your house?
During the past school holiday, actually we go to our grandparents' house at Klang. We stayed there for 2 weeks, and then other than that, there is no other traveling history.
Okay. During that travel, do you have any water activity?
No, no.
No. Okay. House, is it? Mom's house. Okay. Is there any rodent infestation?
I wasn't too sure about that, but I think there is also no rats and all.
Okay. Okay. Thank you, Mrs. I think that is all I want to ask. Thank you again.
Okay, thank you.
Okay.
Okay.
Can you make summary, please, for your history taking?
Um, do you mean to summarize?
Okay.
Okay. I will present it all again, all the points. Okay. So next slide, please. Mm, next slide, please. Okay. Complaint is Novinan, a 5-year-old Indian boy, is presented to the emergency department of HDA due to unresolved fever for 5 days duration. Okay. Next. Upon questioning, it started 5 days ago, where he developed sudden onset of fever, which is associated with chills and rigors. However, there was no rash. His body was warm, large, and the recorded temperature was 39 degrees Celsius. Then he was brought by his mother to the GP clinic, and he was given syrup paracetamol and also antibiotics. The fever resolved temporarily with the medication, but again, a fever also was persistent without any pattern. Besides
Dr.
that,
Fatin, Dr. Fatin, we are not repeating ourselves. I asked you to do summary.
oh,
Don't
okay.
read all again. We already hear. Okay. Ability to do summary is one of the important skill during practicing medicine.
Doctor, can we do the summary after all the physical examination?
No,
Because
no.
after this,
I need you to just summarize the history in like 2 sentences.
okay. Okay, so the patient is a Novinan, a 5-year-old Indian boy, came with sudden
Okay.
onset of fever for 5 days duration, which is associated with chills and rigors. Okay, the fever was persistent, and he also complained of arthralgia and also muscle pain and vomiting, and also vomiting. Okay, previously he has no non-medical illness, and however he has been hospitalized due to constipation, and he has a travel history of going to Klang, which is a dengue endemic region, about 2 weeks, and he also lived in a dengue endemic region, which is in Bukit Setongkol, and his house has no any bird infestation, and his family is otherwise healthy, his siblings and his parents. However, his mom has gastritis, and
Okay.
yes, I think that's all.
Very good. From the history now, because we must be able to get the history and get breath and think. What can be this history alone guide us? Then we have now like broad differential diagnosis. At that moment, we are going to examine the patient. We know for what we are concentrating. So what's your diagnosis from this summary? Forget about even the examination.
I think it is most likely dengue fever with warning signs.
Okay, from this symptom alone, he has a fever and the cough pain and the vomiting. What other differential diagnosis you must suspect? Stop please running the slides now.
Okay, it also can be leptospirosis, and also maybe chikungunya, and other infectious diseases, malaria.
No, we need to teach you not to let you read. What other?
Like I said earlier, it can be leptospirosis because it is associated with muscle pain.
In these days, what other
chikungunya
differential diagnosis? In these days, which you are stay at home.
I think the most likely diagnosis is dengue fever.
No. Why you are staying at home? Did you come to the Kuleya until now?
COVID-19, SARS-CoV.
Is it important to out COVID?
Yes, very important.
Very important, top important, urgent important. Okay. So did you ask about extra questions that you can rule out or help you to diagnose COVID-19? What is the warning signs or the important sign we are asking about the COVID? Sorry?
I didn't really think about respiratory distress.
Okay, respiratory.
Shortness of breath.
Good. What else? Who can help fatten? She said it can be respiratory, especially if you put respiratory distress. What other symptom or sign or complication with the care?
If may also come with diarrhea, loose stools.
Okay.
Is it?
Okay. Alisa, what else?
Loss of smell, anosmia.
Yeah, very important. You must ask about smell and taste. What else? Fatting or Nur Amani.
Can I say dry cough, doctor, and also lethargicness of the patient?
Okay, they spoke about it before. Very important complication which can happen, which is coagulopathy. Did you ask about coagulopathy? It's very important because many of this can go like hemorrhage and abnormal coagulation and sometimes thrombosis, which is very important. Did you ask about any end-organ affection? I know that you have scenario of dengue, but now we are making it live. Usually the COVID can kill person by its severity due to either organ failure, primary can be heart failure or CNS or cardiac or other, can be due to septic shock, okay, and they can be abnormal coagulopathy, especially thrombosis and the like that. Of course, children have more simple COVID than adult, but nowadays the new strain of COVID, we didn't study it fully. So you mustn't forget, please. You must oriented about the days which you are living in. Anyone has fever, has cough, even have rhinitis, I must suspect. That's why if you came, inshallah, soon to the hospital, you are not allowed to see him without wearing the personal protective equipment. Am I clear?
Yes,
Yes.
doctor.
Okay. So all the other points now important, but it is not the top important. This moment, every fever, every pneumonia, everything like that must be considered COVID until proved otherwise, especially documented contacts with others like that, or going to red area, or that you are experiencing that yourself. Okay, so please, you must read something about the COVID and how is the protective lifestyle and what is the protective for us as a healthcare personnel. Okay. Okay, you can go now for your presentation. What is the, just go for the slide with clinical findings. So what is the clinical findings did you find? Just the positive one. Okay. Okay. You didn't come back, please, for the CNS. CNS you used to miss an important one, which is the meningeal irritation sign. Kernig's and Brodzinski are very important. Okay, because sometimes meningitis can be presented by fever and vomiting and some rash like meningococcal meningitis. And at the same time, the dengue as a virus can sometimes affect the brain and cause meningitis or encephalitis or meningoencephalitis. So we must add the meningeal sign, which is Kernicks and the Brzezinski. Okay, continue. So in examination, the patient appeared lethargic, mild dehydration, no presence of dengue warning signs such as liver enlargement, mucosal bleeding, or epigastric tenderness. So we'll come back now to Fatin. What is the warning signs do you know?
Warning signs or warning symptoms, Doctor? Or signs?
All are called as a symptom collectively. So symptoms and signs.
Abdominal pain and also persistent vomiting.
Okay.
Mucosal bleeding, as in the slide, lethargy, restlessness, and hepatomegaly. Okay, and also increase in hematocrit with rapid decrease in platelet.
Okay, so you must know the warning sign from 1 to 7 as your name believes. Okay, it is very important. So the patient has abdominal pain and vomiting, yes?
Yes.
So the issue to divide it into sign and the symptom may make us, we said warning sign, even I got it through the history, through the clinical examination, through the investigation. So I must be able to define what is your diagnosis now, according to the history and the clinical exam.
Dengue fever with
Yes.
warning signs.
With warning sign. So we can divide the dengue into 3 levels. The first one is the simple dengue. The second one is
severe.
Okay.
Dengue.
So we have dengue with warning sign. We have now another, which is the complicated dengue, which can be either shock or hemorrhagic. This is a very important. Okay. So what investigation you will do now, Fatin, for this patient? It looks your okay. So we'll do full blood count to see any hematoconcentration or thrombocytopenia or anemia. Okay. What else?
Liver function test.
Sorry.
Liver function test.
Okay. What did you suspect?
Usually the AST level is more than ALT.
Okay, can be good. Mild transaminites, yes. What else? Ahmad Luqman. Ahmad Luqman. What other important investigation?
Serology test.
Sorry?
Serology test.
What? I cannot hear you.
Serology test.
For?
To know at which phase is the patient.
Yeah, so our patient, how many days now to choose?
5 days.
So what tests you will do? Is it NS1 or IgG, IgM?
The IgG and IgM is starting to climbing at this phase currently.
So you are going to choose IgG, IgM.
Yes, doctor.
Okay, so at the early days, and third day like that, it may be diagnosed. It is IgG, IgM. Combo test, which is combining both, okay? But you must know which one is which is the best time. Other investigation or Amani, you need to use.
We can also test for dengue and S1 antigen.
Okay, we did already the IgG, IgM, and it came positive. The IgG and the IgM, both of them came positive. What else?
We can also do renal profile to see if there is any
Very good. So dehydration state will be clear from there. So usually, if the patient are simple, you are simple. You just do full blood count and the diagnostic test for the combo according to the day. If starting warning sign, we need to make sure about the other body organ. If we start to feel that he has any susceptibility of bleeding or the platelet are very low or like that, we may consider also the coagulation profile, okay? So this is a very important point. Fatin, what is the treatment of dengue?
It is mainly fluid replacement therapy.
Okay, so it is mainly observation and assessment. Frequent observation and assessment. If it is simple, it can be avoided. If it has a warning sign, the patient must be seen at least every 2 hours. If the patient has critical bleeding or query shock, he must be transferred to high dependency or ICU, and he need for continuous monitoring. So number one is monitoring. Number two, as you said, it is symptomatic, but the main pillar is the fluid adjustment. Fluid what? Adjustment. Because sometimes if you give extra fluid, it will be dangerous. Under fluid, of course, it is dangerous. So we need to come to an important conclusion. Monitoring the patient, okay, frequent monitoring and early detection of any problem and judicious use of the IV fluids. Of course, we can use simple antibiotic like that. Okay, that is the point which we need to think about. Now the knowledge, it is easy to pick it, okay, and speak about that, but how to proceed with the patient when I see the patient first minute, what is the differential diagnosis which I am going to consider, and what is the investigation I need to do, what is the care which the patient need on the spot. Okay, you can continue your presentation.
Okay, Assalamualaikum warahmatullahi wabarakatuh. We continue our discussion today with the OSCE questions. Okay, next slide. We go about 4 questions from the OSCE questions. So first question, this boy was presented with fever, headache, and rashes. So as we can see, there is redness or rashes on the arm of the child. So there are 3 questions. First question, according to this picture, describe the rashes. Second, what is your diagnosis and which phase of the disease did the rash start to appear? And lastly, is give 2 complications according to diagnosis. So next slide. So first question, so how we want to describe the rashes itself? There is a specific way to describe the rashes. Islet of white in the sea of red. So we can see describe it the rashes as reddish, a sea of red, where there is an islet of white. Second question, what is your diagnosis and which phase of this disease did the rash appear to the patient? So we can identify these rashes type in the dengue fever in the recovery phase. So we can understand that this condition is a dengue fever. So the 2 most common complications of dengue fever is shock and also multi-organ failure due to the leakage of blood. So next question, question 2. So question 2, a child is presented with fever, myalgia, and also vomiting for 2 days. NSI and also IgM for dengue are positive. Platelet count is still times 10 of 3 per liter. 3 questions. Firstly, what are the other typical symptoms of dengue fever? Second is explain the phase of dengue fever in relation to the symptoms. And lastly, list the warning signs in dengue fever. Next slide. So firstly is the what are other typical symptoms of dengue fever itself. So other typical symptoms presented in other slide in this presentation also provide us with the erythematous molting of the skin and also facial flushing. Next, second question, explain the phases of dengue fever in relation to the symptoms. So as we can know, as we can understand that in dengue fever, there are 3 phases, the febrile phases, the critical, and also the recovery phase. So we just need to explain the symptoms itself. So in febrile phase, there will be high temperature, which then cause dehydration. And the febrile phase, there will be increase in the viremia. We can observe the increase of the dengue, DEM1 or DEM2, 3, 4 organism. And also there will be peak in hematocrit. And the symptoms is flushing, myalgia, rashes, petechiae, and other symptoms. So in critical phase, however, the fever in this in this phase, the fever will be resolved. They'll be reduced in the temperature, and in this phase also there will be decrease in the platelet. But in this phase also there will be increase in the IgG or IgM. So in this phase also there will be capillary leak, severe bleeding, and then this can cause shock due to the reduced volume, and also this can cause organ impairment. And lastly is the recovery phase. We can understand that will be the IgG and IgM still increase in this phase, and also hematocrit will stabilize within time, and the platelet count will be normalized and recovers. There will be fluid reabsorption due to the leakage. From the leakage, there will be fluid reabsorption, and also there will be diuresis. So third question. Next slide. And last question for this question is the list the warning signs in dengue fever. So there will be categorized by clinical and also laboratory. So in clinical, the warning signs is intense abdominal pain or tenderness, persistent vomiting, fluid accumulation, mucosal bleeding, lethargy and restlessness, and also liver enlargement. Also, this clinical warning signs have been explained by doctor and also by Sister Fatin. And also in laboratory, there will be increase in hematocrit with concurrent rapid decrease in platelet count. So this can give us the idea that the patient have dengue fever. So next slide. So third question, a 10-year-old boy was admitted to the hospital with a 4-day history of high fever, headache, and also malaise, and a 2-day history of epistaxis and also hematemesis. And he has been diagnosed with severe dengue. First question is, what are the criteria of severe dengue? Second, list the serotypes of dengue virus. And lastly is why secondary infection is more severe than primary infection. Next slide, please. So we go to the first question. So in severe dengue, the criteria we can understand there will be these three important criteria. Firstly, there will be severe plasma leakage, severe bleeding, and also due to the plasma leakage and also bleeding, there will be cause severe organ impairment. Second question asks us to list the serotypes of the dengue fever. There are 4 types of serotypes of dengue virus. There will be DEM1, DEM2, DEM3, and DEM4. And third question is why secondary infection is more severe than the first primary infection. So in secondary infection, the antibody dependent enhancement, there will be antibody dependent enhancement, which then increase viral uptake and cytokine production will then cause a more severe dengue fever. For our last question, dengue should be suspected when there is a high-grade fever and also there is a history of living or travel in endemic area of dengue. It is probably dengue when it also accompanied by 2 of the following symptoms such as nausea, vomiting, rashes, ache, and pain. Positive tourniquet test, leukopenia, and also any warning signs, as well as laboratory tests that confirm dengue. So for the first question, how to perform the tourniquet test, and also second question, list the risk factors for dengue, severe dengue. Next slide, please. So how we perform tourniquet test? For tourniquet test, from the picture, we can understand that we must inflate a blood pressure cuff on the arm to meet between systolic and also diastolic blood pressure for 5 minutes. The pressure is released for at least 1 minute, and the skin below the cuff is examined for petechiae. So we must observe a finding of 10 or more petechiae in 1 square inch area, which then is considered positive. For the last question of our discussion, list the risk factor for severe dengue. So this is the risk factors such as lethargy, abdominal pain, bleeding tendencies, hepatomegaly, hemoconcentration, and thrombocytopenia. So that's all for my part. I explained about the
Important.
questions.
Come back, please. Come back. Yes. You must differentiate between the warning sign and the severity of the dengue. Okay, bleeding tendency, hepatomegaly, hemoconcentration, very important to consider it other than the warning signs. Warning sign contains some of this. But if you find all this, you will jump from warning sign to severe one. Okay? Can you understand? These
Yes,
are the risk factor for the severe dengue. Warning sign is different. It is just one step before. Okay.
So that's all for our presentation for the first case. So continue with the second case presented by other colleagues.
Wait. Why you are so hurry? So dengue, please, you have a very nice pediatric protocol, and it is a very clinical guidance for you because dengue is one of the most common endemic disease. Okay, and nowadays it is increasing also with the increasing of the COVID. So you must know theoretically from A to Z. At the same time, you must be able to know how to proceed when you see the patient, either if it is dengue or other differential diagnosis, which you must know accordingly. And it is a dengue, so what type of dengue, simple or severe or like that? The third one, what is the top care to be given to the child? I mean, admission to where, to which department, to high dependency, to ICU, to the normal ward are very, very important because your decision and your order can save the life of the patient. Okay? And remember that judicious use of the IV fluid is the most important. Do you need to ask any question? Okay, so we can proceed for the second case. Who will be the doctor?
Me, doctor. My name is Fatin.
Fa, your name is?
My name is Fatin.
So we have Fatin and Fadin. I cannot hear.
The patient is me, Hanun.
Who will be the doctor which I will examine him? Hanim?
The patient name Shakir. I'll be the doctor.
Hanim will be the doctor?
No,
Hanun?
me. Fatin will be the doctor. Hanu will be the mother's patient.
The mother of the patient.
So who was the first one? It is Fatin also?
Fatih
Yes, I'm
Hanani.
Fatin also.
You have two Fatin.
Fatih. Yeah. The first one is Fatih Najih. The second one is Fatih Hanani.
Oh, mashallah, make me okay.
Obvious.
Okay.
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 Right now it's Fatih Hanani. Okay.
Okay, Fatin, after getting maximum 15 minutes with the patient, I will start to examine you. Okay, then your colleague will comment about the theoretical part and the OSCE.
All right. Okay, good afternoon.
Sorry. Thank you. The previous picture for the role player, it put for every bed like crescent. And our religion is different. We are respecting them, but we are not putting the. If you come to the first presentation, you will find for over every bed there is cross. You need to change this one.
All right, doctor. Sorry for that.
Okay.
So, can I start, doctor?
Yes.
Okay. Good afternoon. Is this Mrs. Fatimah, mother of Shakir?
Yes, I'm his mother.
So my name is Fatin. I'm year 3 medical student. Can I ask you a few questions regarding your son?
Yes, yeah, you can.
May I know how old is he?
He is 11 months old.
Oh, all right. So what makes you come here?
Actually, my son experienced fitting and also fever for 3 days.
Oh, I see. So when did you first notice your son experience episode of fitting and the fever?
First, I noticed that he was warm to touch, and it was just a fever on the first day, and the fever lasts for 3 days. On the second day, I noticed he had episode of fitting.
Oh, So regarding the fever, did you notice the fever abruptly or slowly?
I'm not sure about that, but I noticed he was just warm to touch, so I assume he's having fever.
All right. So did you record or check his temperature when he's having the fever?
I didn't record that lah, so
Oh, all right, it's okay. Is the fever can be relieved or aggravated by anything, such as do you give your son any medication?
I'm not sure about that.
May I know if the fever comes along with any other symptoms?
Actually, the fever is with coughing and some flu.
How long has he been cough and having flu? Is there any specific time where his cough worsen, such as at night or some other else?
I'm not sure, but I think it starts after he's having fever until now. And also, I'm not sure is it continuous or same. Yeah.
Regarding the cough, did you notice any the characteristic of the cough? Is it dry or productive, or maybe the color, and is it associated with sputum?
Actually, the cough is not non-productive, but I saw the color is like a clear color.
Oh, or regarding the cough, is it being aggravated when your son move, or that can worsen his cough?
Oh, but I didn't notice any of that.
Okay. Regarding the flu, is it the is what is the characteristic of the discharge? If there is discharge.
It has clear discharge.
So you don't notice any blood or the mucus.
No, it just clear discharge.
So for both cough and flu, is there anything that can relieve his cough and flu, or you give a balm or something else?
For that, I'm not sure. I don't think I give them.
What about his oral intake? Is he still breastfeeding or already start bottle feeding?
He's now has started bottle feeding and stopped breastfeeding until 5 months old. Yeah.
So what about is he getting enough milk every day?
For that, I'm not sure about that, but for now, he has reduced oral intake since having the fever.
Okay. You said that he's having fever, cough and flu. So what about is he active or become inactive when he's experienced fever?
Because of the fever, he wasn't active these days.
Do you notice any change on your child, or he's getting more feverish after for these 3 days?
I noticed that he had high grade fever, and I checked this time. His temperature was 38 degrees Celsius.
All right. Okay. You also complain of the episode of fitting. So regarding this, when did you notice he's having the fitting? Who was around when this happened?
This time is morning. At that time, my husband is there. Husband was there, and he had sudden jerking of his hand, his leg, and he's rolling his eyes and he lost consciousness. But there is no drooling or saliva. There's no clenched teeth like that.
Did you notice how long did it last?
I think like it's quick. It was quick. Like lasted for 2 minutes. It was spontaneously aborted.
Okay. I see. So after the 2 minutes, he gained his consciousness back. So how he gained his consciousness back?
After I call his name many times.
Okay. How is his condition after the fitting?
I become really lethargic after the episode, and so I decided to bring him to the nearest local clinic.
Alright. So you've brought him to the clinic. So what are the treatment given by the clinic?
The clinic, he was given paracetamol, and when he got a cold bath to relieve his fever, but still the next day the fever do not resolve despite that medication.
Oh, so that's why you bring him to the hospital, is it? Because of his temperature remain high?
Yeah, because his temperature remained high, so that's why I brought him to the hospital. And instead, he been treated with paracetamol and discharged at night. Nevertheless, the fever still did not resolve. I am anxious and worried about that jerking of that hand and leg might reoccur again. So I decided to bring him to the emergency department this time and early in the morning.
Is this ever happened before?
It's his first time.
Oh. And is he ever experienced neck stiffness or any irritability?
No, I don't think so.
Right. Is he ever show any discomfort or sensitive towards light, such as when he exposed to sun or bright indoor light?
He's still, I mean, even though he's not active, but he's still okay with it. No problem
Okay.
with that.
Do you notice any rashes around his body?
I don't think I saw any rash on him.
Oh, okay. May I ask, has he been admitted before due to any other medical condition other than this?
Other than this, no, this is his first hospitalization, but he has underlying disease with the disinfectancy.
Okay. Does he have undergone any surgical procedure before this?
Surgical, about that, no, no surgical.
Okay. Sorry to ask Mrs. Fatima, but during pregnancy, do you have been diagnosed with any disease?
As long as I remember, but I had gestational diabetes mellitus.
Oh, for after birth, is he experienced any complication or medical condition?
He developed neonatal, doctor said like neonatal jaundice, because of that disability, and he admitted for treatment lah for 2 days. He had jaundice.
Right. Is he developed normal or notice a bit slow compared to his age?
So the child, he has normal. I think like compared to with the siblings, like it's just normal like that. It's okay.
Okay. Has he started taking soft food?
Soft food.
Yes.
Soft food. At the age of like he is 6 months old, but currently he's just eating porridge.
Okay. So any medication has been prescribed for him, or does he have any known drug or food allergy?
For now, he had the paracetamol, the syrup paracetamol for his fever,
Okay.
and he has no allergy.
Okay. Is he completed his immunization according to the schedule up to his age?
Yeah, he complete all immunization.
Okay. Sorry, Mrs. Fatima. May I know how many child do you have? And Shakir is
Shakir is the first child of two siblings, and his younger brother was at the hospital for preterm at 7 months old.
alright. I see. Do you or your husband have known medical illness or any chronic disease?
My husband and I have no medical illness. Like we don't know asthma, diabetes mellitus, heart failure. We don't have all that.
Oh, okay. Is there any family member that exhibit the same symptom before this?
No, no.
Okay, alright. So regarding your procedure, can I know what are your occupation and your husband, or do you a housewife?
My husband is 29-year-old policeman, and he also a smoker, while I am 27-year-old policewoman.
Okay, so both of you work. So since you're working, who will be taking of the child? Did you send him to the nursery?
He's at the babysitter's house when we are working. So, and also the babysitter taking 6 to 7 children.
Oh, Mrs. Fatima, may I know where do you live?
I live in Wheeler and Camp Bukit Galing.
Oh, is the environment okay or near to the factory or the neighborhood is dengue prone area?
No, it's not that.
Oh, okay. So the environment is okay. So recently, did you travel to any place or go in contact with any sick people in this recent time?
We don't go traveling or something.
All right. Okay. So thank you, Mrs. Fatima, for giving full cooperation. So we will update you later regarding your children's condition.
Okay, thank you, doctor.
Fatin Nani. Okay, can you me just summary with few sentences?
This patient, Shakil, 11 months old Malay boy, born full term with no developmental delay, presented with fever of 3 days and episode of fitting, which was generalized. And the fitting lasted for about 2 minutes and was spontaneously aborted. And the patient also the patient has high grade fever with temperature of 38 and become lethargic after the episode of fit. The fever did not resolve despite the medication given twice. And yeah, the patient also has normal developmental milestone and normal feeding and vaccination. There's no strong family history. Yeah.
What is a strong family history?
There's no genetic inherited disease except for the G6PD deficiency.
So you must ask about genetic or hereditary disease. Any febrile convulsion in the family is very important. Any skin manifestation like neurocutaneous syndrome. So all this must okay.
Okay.
Again, no family history of genetic or chromosomal disease, no family history of febrile convulsion. This is one of the most important point you must care about. And no history of epilepsy, and no history of neurocutaneous syndrome. What is neurocutaneous? It is a lot of syndromes combining the skin and the brain. And you know that the skin and the brain both came from ectoderm. So there is neurocutaneous syndrome like neurofibromatosis. There is a lot of that and must be ruled out. Okay. Good. So what is your working diagnosis now, Hanani?
Simple febrile seizure.
Why simple?
Because it is associated with high grade fever and the seizure lasted about only less than 5 minutes.
So when I change my diagnosis from simple to complex,
When the seizure lasted when the seizure lasts more than
15.
15 minutes, yeah.
What else?
Also the febrile episode is more than there is recurrence of seizure during the febrile episode.
Okay, the first 24 hours. What else?
The features of the seizure will be focal for the complex.
It can be focal, then generalized. Start focal and then generalized. It is very dangerous. And the last one? Good. The last one is?
Neurological deficit, the thoughts paralysis.
So it is post-ictal neurological deficit. Usually,
Yeah.
They can sleep for a short time like that, but to go like towards the paralysis for a longer time or get hemiplegia or any neurological deficit, it must be shifted from just a simple to complex febrile seizure. Okay, what is your main differential diagnosis? Is the child has fever and convulsion or fever and fits?
The main?
The most important differential diagnosis.
Meningitis?
Yes, of course. So infection in the CNS, which can be meningitis, encephalitis, or even meningoencephalitis. Okay. Lotfi?
Yes.
If you are speaking now about the convulsion itself or the fits, what did you suspect can be the cause?
Sorry.
Generally, what is the cause of fit?
It can be due to metabolic problem like hypoglycemia. Also can cause generalized fitting.
Another? Just you need to come back to your pathophysiology. What is the pathophysiology of diseases which we learned just in the first 2 years? It can be metabolic, you said. Your colleague said it can be infectious, but infection outside the CNS or infection inside the CNS. What else?
can be due to trauma leading to brain injury.
Very good. Either accidental or non-accidental. I mean by the accidental, it is accident. Non-accidental, it may be intended by child abuse one. Okay, very good. What else? We have malignancy. So it can be brain tumor or increased intracranial pressure, which is very important. What else? It can be metabolic, can be infection, can be malignancy, can be autoimmune, affect the brain cells like SLE, like many autoimmune, can be accompanied by even convulsion and the CNS manifestation, and it can be trauma. And don't forget, it can be due to other end organ failure. What is the end organ failure? Like severe encephalitis. Okay, due to hypertension, hypertensive encephalitis. The patient will come with convulsion. Many cases we saw, the patient came with convulsion, and just when we measured the blood pressure, we found it high. We said it may be due to convulsion. Just repeat after the convulsion stop, it is still high. So just ask the mother, Mom, how is the color of the urine? She said it is cola light. So Emir, for this scenario, what is the diagnosis? Child came for convulsion, we found him hypertensive, and we found the urine it changed to be like cola or tea color. Emir,
I think doctor, he has a internet problem.
are you sure? Okay, so can you help him?
Sorry.
That child came with convulsion. We found him hypertensive, and we found the urine colored like cola or tea. This is glomerulonephritis causing severe hypertension. Okay, in our country we see a lot of cases with post-streptococcal glomerulonephritis. Don't forget the color of the urine in glomerulonephritis is cola or tea color, and the patient mostly presented by severe hypertension due to edema. Okay, we'll come back to Hanani. What is the definition of status epilepticus?
Sorry, doctor.
The definition of status epilepticus.
Status epilepticus, if I'm not mistaken, is a single seizure that lasts more than 5 minutes or 2 or more seizures within 5-minute periods without return to normal consciousness between them.
From where you got this 5 minutes? Status epilepticus. Can someone open the pediatric protocol?
Yeah,
isn't it the failure of the mechanisms responsible for seizure termination? It's a condition because of that.
No, I'm speaking what is the definition of status epilepticus. We have status asthmaticus, we have status epilepticus. Status epilepticus means the patient has persistent fits. So for how long? She said 5 minutes? No, it is 30 minutes. Okay? So either the patient got fits for 30 minutes, it means he come to me and has told me I am in the emergency, he now has fits for about 1 hour or 40 minutes. Or who got fits and another fits and in between, he didn't regain his consciousness. So I will consider him status, okay? But even if the patient came just for 5 minute convulsion in the emergency, we are going to treat him. We will not wait until he came to status, okay? This is the issue which is important. Okay, so we must learn what is the type of fits. It is focal or generalized. Okay, we must know how to advise the family to deal with the fits, and you can continue your presentation, please. No, just okay. Can bypass this? If negative, you just tell us the positive points. So the positive here is the throat is mildly inflamed. Yes. Otherwise, his neurological examination are normal. Okay. So he has no hypertension. Okay, very good. Okay. No signs of pneumonia. Okay. Inshallah, I will sit with you after that for how to examine the CNS, so to be alert. So mental status, cranial nervous motor, okay, and ataxia, respiratory, okay, mild inflammation of the throat, okay. Continue the next. Very good. I'm so happy with you to speak about negative findings, which is very important to us. I mean, some negative signs consider positive. Again, some negative signs consider positive. So to tell me there is no Kernigs and Brzezinski, or in this case, the baby are very young, you tell me the anterior fontanelle is normal, normotensive. Do you understand that? So some negative points consider positive. Okay. So this is your professional diagnosis. Okay. Very important. I just taught your colleague yesterday about the tonsillitis. What is the stage of tonsillitis from normal one or mildly infected until the kissing one, which the tonsil are coming, touching themselves, which is the more severe, which is stage 4. Okay, good. Continue. So to rule out meningitis is the top important. What is the difference between meningitis and encephalitis?
Meningitis is inflammation of the meninges or layer of brain, dura mater, arachnoid mater, subarachnoid.
What is the encephalitis?
But encephalitis is the brain parenchyma, the part of brain itself was inflamed.
So clinically, this is clinic as a definition, but how can I how can I diagnose it clinically?
Maybe under current CNS examination, we can test for bruising key and also chronic sign. If both positive, so it highly suggestive of meningitis.
Sometimes the patient has meningoencephalitis.
Oh.
The encephalitis are very famous with two important things like photophobia and the behavioral changes. If you found the photophobia and the behavioral changes, it's very important. Remember, if someone bitten by a dog and he got the rabies, the first sign he is very afraid and his make everything dim. He has photophobia. The same with meningitis, if due to virus or like that, to have photophobia and some behavioral changes are very important. Okay. So meningitis, encephalitis, hypoglycemia is an important lesson. Any patient has convulsion, you must did for him dextrosticks on the spot, because treatment of hypoglycemia are very simple and it will stop. If the hypoglycemia causing convulsion, it will respond to the dextrose very rapidly. Okay, thank you for that. Continue. So it is either simple or complex, and we have the issue here. Okay, focal, so very good. And then the most common cause for infection. Don't forget two important infection in the pediatric, which is the urinary tract and the ear. Usually it is missed, UTI and otitis media. Okay. So it is very important for any blood test we request to know what we are searching for. Your colleague before speak about the full blood count and she is looking for hemoconcentration. Now we are thinking about other things, about white count and the infection and like that. What about the platelets? So it is very important to know what we are searching for our investigation. Okay. So you must know from this important slide, the neutrophil occur with what with which infection? Usually it is bacteria. It will cause neutrophilia, and if it is more severe, it can cause neutropenia. The causative for lymphocytosis usually is a viral. Monocyte can some atypical microbe like mycoplasma and chlamydia. Eosinophils can occur with allergic or parasitic infestation. So you must know which part of the differential white count is the cause for that. Okay, it is very important. Thank you. Continue. Renal profile, of course, are very important, and you must know the normal, please. It is written in front of you. Okay, next. Yes, calcium, phosphorus, and magnesium are very important if the patient has convulsion, because hypocalcemia and hypomagnesemia, both of them can cause convulsion. Okay? Both of them can cause convulsion. Blood sugar we speak about, even during resuscitation, you must do A, B, C, D, which is dextrose, and the other D. Okay? Next. Urine, very good, not to miss the UTI. Okay? So you can comment on the management now, please. Your voice is not clear.
Sorry, doctor, for the management.
Okay.
For this child, as he had a high grade fever with temperature of 39 degrees Celsius, so the management for the patient is given syrup paracetamol. For the high grade fever, we monitor the level of the oxygen as well as the respiratory rate and also the heart rate. And also because of the high grade fever, maybe we can resuscitate the fluid resuscitate. Check for the fluid, whether the patient is hydrated or dehydrated. And the patient also had loss of appetite and also enlarged tonsils and also inflamed throat. So the patient had given syrup paracetamol to reduce the inflammation. And vital signs were regularly monitored to keep at the normal range. And due to the seizure, the feed check was used to monitor to look for and if there is any recurrence of the seizure.
Okay.
So that's all.
That's all.
For the management.
Okay. You can go for the OSCE.
Okay, inshallah, I will continue for the OSCE question. There are some questions I put here. First station is, this boy of 2 years old was presented with fever and seizure without any abnormalities noted, and he was brought to the clinic. The first question is, take your diagnosis. Second one is characteristic of that diagnosis. So this patient, from this statement, this patient is just normal, but have seizure associated with fever. So the main diagnosis at this point we can say is just febrile seizure because it didn't mention about the duration, about the involvement of part of body that we can differentiate between simple and complex. So we just mentioned as febrile seizure. And for the characteristic of diagnosis, next slide. Okay. First of all, seizure associated with fever. Second one, based on predatory protocol, it commonly seen in 3rd month to 6 years old, and it has absence of intracranial pathology like meningitis, encephalitis, and any infection. And also, it has no evidence of metabolic derangement like hypoglycemia, hypocalcemia, and so on. So next question. So the picture below shows a child that having febrile seizure. Okay. Name 2 types or classification of above condition like we have mentioned before. Under febrile seizure, we have 2 types, which are, next slide, which are simple febrile and also complex febrile seizure. So how to differentiate between both? First of all, in terms of duration, if less than 50 minutes, it is simple. More than 50 minutes, it is complex. Generalized seizure more occur in simple and focal features occur in complex febrile seizure. And for simple febrile seizure, there is no recurrence during the febrile episode, means it only occur once during febrile episode, but it can occur more than one of seizure during the febrile episode in case of complex febrile seizure. And also under complex febrile seizure, it has neurological deficit post-ictally, means the muscle weakness, everything deficit after the seizure, after the episode of seizure. For example, in case of thought paralysis. So history taking is very important here. So we must ask the question in terms of duration, in terms of part of body involvement, how many it occur to in order to differentiate between simple and also complex febrile seizure. Next session. Okay, a girl was brought to hospital due to seizure, which is associated with fever for more than 20 minutes. Within that period of having fever, her mother mentioned she was developed 2 seizures before. So the first question is state your diagnosis. Second one, mention the clinical features. Third, 2 complications of above condition. So we can see in this scenario, the patient have fever and also seizure. So probably febrile seizure. And another clues it mentioned here, more than 20 minutes and also develop more than 1 seizure. So it is more likely to be a complex febrile seizure. Next question and next slide. Okay. So the clinical features of that condition of complex febrile seizure, it's mainly based on the underlying focal seizure. So it depends on the lobe or on the part of brain that affected. If it occurs in parietal lobe that used for sensory information, so the patient might come with numbness, tingling sensation, and so on. So if the patient got problem in temporal lobe, so the patient might have deja vu symptoms. For frontal lobe, the patient might have wave-like sensation in head, and for occipital lobe, that are used for visual, so the patient might have visual disturbance and also hallucination. And then 2 possible complications of complex febrile seizure. It's actually less common to develop complication, but if there is complicated, so the problem might might occur. For example, epilepsy it is a recurrent seizure, and also recurrence of same illness, means recurrent of complex febrile seizure afterwards, but it just occur around 15 cases, 15%. Next question. Okay, this is the last question. The picture below shows a child that has been confirmed by doctors having febrile seizure. So state your 2 other differential diagnoses. So we have mentioned before. Next slide. We have mentioned before. Other than complex febrile seizure, we have another differential diagnosis that also show the same symptom like fever and also seizure. For example, infection due to meningitis, encephalitis, and also due to trauma, brain lesion, one of course, and also metabolic problem like hypoglycemia, hypocalcemia, and hypomagnesemia, like I mentioned before. And then explain briefly about pathophysiology of simple febrile seizure. Simply, it due to physiologic condition and genetic susceptibility. So both factors eventually lead to the elevated body temperature. So what happened? Elevated body temperature can impact the ion channel. Why? Because the ion channel is generally operated in a temperature dependent process. Mean the ion channel is affected by the temperature. So if this ion channel is affected, it may cause increase in glutamate, which is excitatory neurotransmitter, and reduce GABA, reduce inhibitory neurotransmitter. So the effect afterward is high excitability of neuron transmission, and then cause febrile seizure in the case. So I think that's all, covering 2 cases for today, dengue and also febrile seizure.
Okay, that's fine. I think today we getting an important two cases. Okay, the one is the fever, and the fever is a very wide differential diagnosis. And then we try to narrow it with febrile seizure, okay, which is a very important, okay. To know the causes, whenever you must think wisely. If you go to one patient with convulsion, you must ask yourself, is it febrile or afebrile? Okay, because if it is afebrile, it is different. It may be just epilepsy or others. So you must ask yourself first, is it febrile or afebrile? Afebrile seizure, completely different pathway. Maybe metabolic, maybe epilepsy. If it is febrile, I must ask myself, is it infection in the brain or outside the brain, which will define the febrile or CNS infection. And I must rule out all other causes, okay? And I must know about the resuscitation of the patient with fits, and I must teach the family and counsel them about how to do during this panic time, okay? At the same time, I must be prepared. I must open the pediatric protocol and know what is the sequence, which can be started by just simple the CBL until sometimes I need to intubate and paralyze the patient. I am intubating here just to give him muscle relaxant to let him completely relax. And if you relax the respiratory muscle, of course, he cannot breathe. So you must intubate. So it is very important to know our role. And don't forget, please, simple trick to rule out hypoglycemia. Remember that calcium, if it occurs, it causes something known as hypopedal spasm. It will be the child will do like voice from his larynx, and his hand and the foot cause carpopedal spasm. If you catch it, you know that this child has hypocalcemia. It is not convulsion or fit. And remember that there is a big series of situation looks like pseudo seizure. It is present in the Nelson and a very nice table. What is the something which can be confused as a seizure? Okay, can be psychological, can be other, can be some abnormal neurological movements. Let us revise for that. Okay, so it is very important to concentrate now by symptom or sign problem teaching. I will start from this, and I have like a very big journey to come back to my febrile convulsion. Oh, it can be CNS infection with meningitis. Oh, it can be also encephalitis or meningoencephalitis. Oh, it can be hypoglycemia. It can be increased intracerebral pressure. How can I define the intracerebral pressure? What is the signs and the symptom? How can I decrease it? Okay, it can be, oh, it looks that the family concordance is not normal. I am afraid this child can be child abuse, so I need to go to social work, and it is very important to protect the child. It can be a child abuse. It can be the patient has glomerulonephritis and hypertension, and I must take care about the blood pressure, otherwise he will be deteriorated. All this like a journey. So I have one scenario, but I know like you now, you are 10 around me, I know 10 scenarios. And I swear in every moment of your life, you will see this scenario. If you are not alert, you will miss it, and it is not good. You can diagnose brain tumor. You can diagnose increase intracerebral pressure, whatever the cause. So it is very important, please, to do that. Even for fever, if you go and read about the differential diagnosis of fever and rash, your colleague let us see the rash of dengue, but what about the rash of measles? What about the rash of herpes simplex? What about the rash of fifth disease and the sixth disease? What about the fever or the rash of leptospirosis? What about the other sign? What about the Kawasaki? What about, so it is very, very, very important to understand the scenario for the disease. At that point, you will be, inshallah, safe physician. And you still have a very good time, about 1,000 days. If every day try to go to one symptom and to concentrate in it, and they make just go to up to date and read what can cause fever in a childhood, cause rashes in a childhood. Because it's very simple, wallahi. If you need to be a professional doctor, you can be very easy. But just start, don't waste your time, try to make use and try to be systematized and try to archive all your job. If you see a good cases, please go and just read about it and put it in one file. It is very good. Okay. Thank you. And see you again, inshallah. Hoping to see you in the world and practice our clinical sessions, inshallah. Ameen. Ameen. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, Doctor.
First,
Thank you, Doctor.
sorry. First, Fatin, I will offer her 6.5 because she didn't understand that her role is a responsible doctor, not getting history only. We are not doing the role player against role player. You must know the situation and be very clear. For second, Fatin Hanin, it will be 7. Okay. Thank you. Assalamu alaikum.
Okay.
Thank you, Doctor.
Thank you, Doctor.
Thank you.